John came to our clinic with severe lower back pain and tingling running down the back of both of his legs. For 3 months, he had no idea why it started, and the pain was so sharp he could barely take a few steps without stopping. After beginning care with us, something finally changed. Over the next month, his pain dropped by 70%, and by month 3, he was back to normal workouts and even running again. What helped him may be the piece you're missing too. If you're dealing with an L4-5 or L5-S1 disc bulge and the medications, injections, or physical therapy haven't made a difference, you need to hear this. When those treatments fail, the pain is not random. It usually means the disc is not decompressing the way it needs to. In this video, I'll show you the exact point when decompression becomes the right move and when it isn't. By the end, you'll know if this approach is safe, appropriate, and worth pursuing for your specific disc problem, and why your past treatments may not have worked. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I help people get relief from disc bulges, sciatica, pinched nerves, and chronic spinal issues without surgery or medication using chiropractic corrective care. Subscribe now if you want simple exercises and proven tips to help you feel better, move better, and stay pain-free. Before we dive in, here's what we're going to cover in this video and why it matters if you have a lumbar disc bulge. First, you'll learn why your disc pain keeps coming back, even after medications, injections, physical therapy, or traditional chiropractic care. This alone can save you months of frustration. Second, you'll see the key signs your disc needs more than standard care, so you can tell if the current approach is actually helping or wasting your time. Third, I'll show you what real disc healing actually takes, including what effective decompression care should look like and what early improvements you can expect. And finally, you'll learn how to know if decompression is right for you with simple decision points that help you avoid guessing and choose the safest, most effective path forward. If you have a lumbar disc bulge, you've probably already noticed a frustrating pattern. Something helps for a few days, maybe even a week, and then the pain creeps right back, sometimes even worse than before. And every time it returns, you start wondering if you're missing something important. But here's the part most people never get told. The usual tools like medications, injections, exercises, and even traditional chiropractic adjustments can give temporary relief, but they rarely change the underlying issue. They can calm the inflammation, they can loosen the tight muscles, they can help you feel a little more mobile for a short time, but they do not consistently reduce the mechanical pressure on the disc itself. This is where the anatomy matters. The disc at L4-5 and L5-S1 take on more load than any other levels of your spine. They sit at the bottom of the weight-bearing chain and act like cushions between the vertebrae. When a disc bulges, it pushes outward and often presses on nearby nerve roots. This is why the pain doesn't just stay in your lower back. It can shoot into the hips, run down your leg, or cause tingling, burning, or numbness all the way into the foot. And here is the key. If the disc continues to stay compressed in that irritated position, the nerve doesn't get a break. So even if the muscles feel better for a little while, the pressure on the disc is still there, which is why your symptoms might disappear for a bit, only to flare up the moment you sit too long, walk too far, or bend the wrong way. A disc problem needs something very different from general stretching or adjustments. It needs controlled, targeted decompression that actually reduces the load on the specific disc so the nerve can calm down and the tissue can heal. When the disc is not given the kind of pressure change, the pain cycle repeats no matter how many treatments you try. So if you feel like you have been trying everything and getting nowhere, you aren't crazy and you're not alone. Your disc is simply not getting the one thing it needs to heal. Understanding that is the first step toward real, lasting relief. Once you understand why disc pain keeps coming back, the next step is knowing when it's time to consider something beyond the usual treatments. And most people miss these 3 signs because they assume the pain is still just muscular or just inflammation. But disc issues have very clear patterns. One of the biggest signs is pain that does not match activity. Maybe you feel fine for a moment, then standing in line starts a deep ache in your lower back, or a short walk triggers that sharp pain down your leg, or sitting for even 10 minutes makes your foot tingle or go numb. These are not muscle patterns, they're nerve patterns. Another sign is pain that moves. A muscle strain usually stays in one place. Disc-related pain changes. It can start in your lower back in the morning, shift to the hip in the afternoon, then fire down your leg in the evening. When your symptoms travel or change location, it's often the disc irritating the nerve root in different ways. A third sign is improvement that never holds. If stretching, resting, icing, or taking meds calms things down temporarily, This is your body telling you that the underlying pressure on the disc is still there. Short-term relief with fast flare-ups means the disc is not stabilizing or healing. And the most important sign is weakness or coordination changes. If your leg feels unsteady and your foot feels different, or you start compensating on one side without realizing it, that's not a surface problem. That is a nerve being affected. The same is true for numbness or tingling in the foot or toes, especially when it comes and goes or follows the same path each time. There are moments when standard care usually reaches its limit, not because it's bad care, but because it's not designed to physically change the pressure on the disc itself. When these patterns show up, you need an approach that actually addresses the disc mechanics, not just the surrounding tissues. Once you recognize the signs that your disc needs more than just standard care, the next step is understanding what an effective approach should include. And this is where a lot of people get misled, not because the treatments are bad, but because they're not designed to create the one change a damaged disc needs. Real disc healing starts with a controlled traction that is targeted, consistent, and measurable. The key is not simply pulling or stretching the spine. It's creating a gentle, sustained force that opens that specific level where the disc is irritated. When this happens, two things occur. Pressure inside the disc drops, and the surrounding nerve root finally gets room to breathe. That space is what allows inflammation to settle and healing to begin. Another component is precision. General traction or machines that pull the whole spine at once rarely isolate the exact disc that's involved. For L4-5 or L5-S1 issues, the pull angle, force, and timing need to be set so that the decompression actually targets the lower lumbar levels. When the force is too generic or inconsistent, the disc does not respond. The next piece is consistency over time. Discs heal slowly. They respond to repeated cycles of pressure reduction and rehydration. That's why the first few weeks of proper decompression usually bring small but meaningful changes, like reduced leg symptoms, better tolerance for sitting or standing, or less morning stiffness. These are early signs that the disc is stabilizing, not just being soothed. And finally, effective care involves supportive strategies that protect that progress. These often include specific muscle activation, controlled movement patterns, and avoiding positions that recompress the disc during the healing phase. When the decompression is done correctly and the follow-up strategies support it, the disc has a real chance to recover instead of repeating the same irritation cycle. Before we talk about who is a good candidate for spinal decompression, we need to start with who is it not for. There are a few situations where spinal decompression is not only the wrong choice, it could delay the care you urgently need. If you have symptoms of cauda equina, spinal decompression is not appropriate. That includes loss of bowel or bladder syndrome, saddle anesthesia, where it's numbness or loss of sensation in the area you sit on, or a sudden significant weakness in both legs. These are signs of a medical emergency. You need to go to the ER immediately for possible surgical intervention. If you have long-lasting nerve compression that's already caused muscle atrophy or chronic foot drop, decompression may help, but it may not fully reverse the damage. In these cases, you should still consult with a surgeon to determine whether a combined approach is needed. Now let's talk about who is a strong candidate for decompression. Spinal decompression may be right for you if you've been diagnosed with a lumbar disc bulge, herniation, or protrusion, and you're dealing with shooting leg pain like sciatica or numbness or tingling that has started to affecting your work, your family time, and your everyday activities. Especially if you've tried stretching, physical therapy, traditional chiropractic adjustments, injections, or medication, and none of them have fixed the problem. That is one of the strongest signs that your disc needs a different approach. If your symptoms started about a month ago, you may still be in the acute phase. And yes, decompression can help. The protocols are adjusted for newer injuries, and earlier care can prevent the problem from becoming long-term. If you've been dealing with disc symptoms for 3 to 6 months, you're definitely a candidate. By this point, any therapy you tried should have already produced 50 to 80% improvement. If it hasn't, that usually means the disc itself is still under pressure and needs a more targeted intervention before it turns into a chronic issue. And if you've been suffering for more than 6 months or even a year, you can still be a strong candidate. We've helped many patients in that exact situation get meaningful long-term relief through non-surgical spinal decompression, even after months or years of ongoing pain. At the end of the day, the best way to know for sure is to get evaluated by a doctor who specializes in spinal decompression. They can assess your imaging, your symptoms, and your function to determine if this is the right path for you. If you're in Houston, Texas, reach out to us. We can guide you through the process, answer your questions, and help you find the safest, most effective way forward. You should now have a good understanding of when spinal decompression makes sense, when it doesn't, and how to decide if it's the right path for you. Don't lose hope. If you've tried therapies, medications, or injections and they failed, there's still a real chance for improvement. Give non-surgical decompression a try. Look for a spinal decompression doctor in your area, and if you need help finding a solid one, comment below and let me know. If you found value in this video, like or share it so more people dealing with disc issues can finally get clear answers. And remember to subscribe if you want exercises, strategies, and proven tips to help you feel better, move better, and stay pain-free. Now, the next video you should watch is this one: 5 gentle daily moves to relieve lumbar disc pain, if you want to start getting relief at home. It's one of my most watched videos. Go watch it now.